In this video, we will explore the top 25 interview questions that commonly arise for NHS Healthcare Assistant positions. Each question is designed to help candidates prepare effectively for their interviews in the healthcare sector. Alongside the questions, we will provide insightful answers and tips to enhance your responses. This guidance aims to boost your confidence and improve your chances of success in securing a healthcare assistant role. 1. Why do you want to become a healthcare assistant in the NHS? Becoming a healthcare assistant in the NHS aligns with my passion for helping others and commitment to community health. I admire the NHS for its dedication to providing quality care to all patients. I want to be part of a team that supports individuals during vulnerable moments in their lives. Working closely with patients allows me to make a tangible difference, whether through offering physical assistance or emotional support. I believe this role will provide me with invaluable experience while contributing to the compassionate care that the NHS stands for. 2. What do you understand about the role of a healthcare assistant? The role of a healthcare assistant involves supporting healthcare professionals in providing care to patients. This includes assisting with daily activities such as bathing, dressing, and feeding, as well as monitoring vital signs and reporting any changes in a patient's condition. Healthcare assistants are essential in creating a comfortable environment for patients, ensuring their emotional and physical well-being. They also play a vital role in maintaining hygiene standards and documentation. Effective communication with patients and staff is crucial, ensuring that care is delivered compassionately and efficiently. 3. What qualities do you think are essential for a healthcare assistant? A healthcare assistant should possess empathy, compassion, and strong communication skills. Empathy allows them to connect with patients on a personal level, understanding their feelings and needs. Compassion is vital in providing comfort and support, especially during difficult times. Effective communication ensures that they can relay important information to both patients and other healthcare professionals clearly. Additionally, being adaptable and resilient helps them cope with the demands of the job, while attention to detail ensures high-quality care and safety for patients. 4. Can you describe your experience in providing patient care, if any? I have volunteered at a local care home, where I assisted with daily activities for elderly residents. My responsibilities included helping with personal hygiene, meal preparation, and engaging residents in social activities. This experience taught me the importance of empathy and patience in providing support. I learned how to communicate effectively with individuals who have varying levels of cognitive function. I also participated in training sessions on basic first aid and infection control, which enhanced my skills in maintaining a safe environment for patients. 5. How would you handle a situation where a patient is upset or confused? When a patient is upset or confused, I would first approach them calmly and with empathy. I would listen attentively to their concerns, acknowledging their feelings without judgment. It's essential to provide reassurance and validate their emotions. I would use clear, simple language to explain any procedures or information they might find confusing. If needed, I would involve other healthcare professionals to ensure the patient feels supported. Maintaining a compassionate demeanor helps build trust and can significantly ease their distress. 6. What do you know about the NHS values and how would you apply them in your work? The NHS values include respect and dignity, commitment to quality of care, compassion, improving lives, and working together for patients. I would apply these values by treating every patient with kindness and respect, ensuring their needs are prioritized. By committing to high standards of care, I would strive to provide effective support, continually seeking ways to enhance patients' experiences. Collaboration with colleagues is vital. I would actively engage in teamwork to ensure holistic care for patients, promoting a supportive environment that fosters trust and safety. 7. How do you prioritize tasks when caring for multiple patients? When caring for multiple patients, I prioritize tasks based on urgency and the specific needs of each individual. I first assess which patients require immediate attention, such as those in pain or needing assistance with basic needs like eating or using the restroom. Communication with my team is crucial. I keep them informed of my priorities and seek help when needed. I also review patient charts regularly to stay updated on their conditions. Time management is key, and I ensure that I allocate time efficiently while remaining flexible to adjust priorities as situations change. 8. Describe a time when you had to deal with a challenging colleague or patient. When working in a previous role, I encountered a colleague who was consistently negative towards patients, which affected team morale. I decided to approach them privately and expressed my concerns about the impact of their behavior. I emphasized the importance of maintaining a positive environment for patients and our team. During our conversation, I actively listened to their perspective, which revealed they were facing personal challenges. By suggesting support resources and encouraging a team approach, we were able to improve their attitude and ultimately enhance patient care. This experience taught me the value of empathy and communication in resolving conflicts. 9. How do you ensure patient confidentiality and data protection? Ensuring patient confidentiality and data protection is paramount in healthcare. I follow strict protocols, such as only discussing patient information in private settings and ensuring that all records are securely stored. I am aware of the importance of compliance with GDPR regulations and the NHS guidelines on information governance. Additionally, I always use secure methods for sharing information, such as encrypted emails or secure messaging systems. Training on data protection policies is regularly undertaken to stay informed of best practices and any changes in legislation. 10. What do you understand about infection control procedures? Infection control procedures are essential practices aimed at preventing the spread of infections within healthcare settings. These procedures include proper hand hygiene, the use of personal protective equipment, PPE, and the safe handling and disposal of contaminated materials. Regular cleaning and disinfection of surfaces and equipment are crucial to minimize infection risks. Additionally, staff must be trained to recognize signs of infection and adhere to protocols for isolating affected patients. By following these guidelines diligently, we can protect both patients and healthcare providers, ensuring a safer environment for everyone involved. 11. How would you respond if you witnessed a colleague not following proper hygiene protocols? If I witnessed a colleague not following proper hygiene protocols, I would first assess the situation to ensure patient safety. I would approach the colleague discreetly and express my concerns in a non-confrontational manner, highlighting the importance of adhering to hygiene standards to protect both patients and staff. If the behavior continued or if I felt uncomfortable addressing it directly, I would report the incident to my supervisor or the appropriate authority to ensure that the issue is addressed effectively. Maintaining a safe environment is essential in healthcare. 12. Can you explain the importance of accurate record keeping in healthcare? Accurate record keeping in healthcare is vital for ensuring patient safety and continuity of care. It allows healthcare professionals to track patient progress, monitor treatment effectiveness, and make informed decisions. Proper documentation also facilitates communication among team members, reducing the risk of errors. Additionally, accurate records are essential for legal compliance and can protect healthcare providers in case of disputes. Maintaining up-to-date records helps ensure that patients receive the best possible care and supports effective healthcare delivery across all settings. 13. How do you stay calm and focused in high-pressure situations? In high-pressure situations, I prioritize remaining composed by practicing deep breathing techniques and focusing on the task at hand. I remind myself of the importance of my role and the impact my actions have on patient care. Staying organized helps me manage my time effectively, allowing me to address immediate concerns without feeling overwhelmed. Additionally, I rely on clear communication with colleagues, which fosters teamwork and ensures that we provide the best care possible, even during stressful moments. Keeping a positive mindset helps me navigate challenges effectively. 14. What would you do if a patient refused care or medication? In such a situation, I would first approach the patient calmly and respectfully, seeking to understand their reasons for refusing care or medication. Active listening is crucial, as it allows me to address any concerns they may have. I would provide clear information about the importance of the treatment and any potential consequences of refusal without pressuring them. If the patient remains firm in their decision, I would respect their autonomy, document the refusal accurately, and inform the healthcare team to ensure continuity of care and to explore alternative options together. 15. How do you maintain a positive attitude when dealing with difficult patients or situations? Maintaining a positive attitude in challenging situations requires a combination of empathy and self-awareness. I focus on understanding the patient's perspective, which helps me respond with compassion. Taking deep breaths and practicing mindfulness can significantly reduce stress. I also remind myself of the importance of my role in providing care and support. Engaging in active listening allows me to connect better, which often calms the situation. Lastly, I seek support from colleagues when needed, as sharing experiences can uplift morale and enhance resilience. 16. Can you describe your experience with assisting patients with mobility issues? I have had the opportunity to assist patients with mobility issues during my training and volunteer work in healthcare settings. I supported patients in moving from their beds to wheelchairs, ensuring their safety and comfort throughout the process. I learned to use mobility aids, such as walkers and canes, and provided physical assistance while promoting independence. It was essential to communicate effectively with patients, understanding their needs and preferences. Building trust helped me encourage them to engage in mobility exercises, enhancing their strength and confidence while navigating their environment. 17. How would you communicate with a patient who has difficulty speaking or understanding? Communicating with a patient who has difficulty speaking or understanding requires patience and empathy. I would start by ensuring a calm and comfortable environment. Using simple language, I would speak clearly and slowly, allowing the patient time to process information. Nonverbal cues, such as gestures or facial expressions, can be effective in conveying messages. I would also encourage the use of visual aids, like pictures or written instructions, to enhance understanding. Active listening and asking open-ended questions can help engage the patient, making them feel valued and involved in their care. 18. What would you do if you noticed a change in a patient's condition? If I noticed a change in a patient's condition, I would first assess the situation by observing any physical or behavioral changes. It is crucial to remain calm and gather all relevant information. I would then report my observations to the supervising nurse or physician immediately, ensuring that I provide clear and concise details about the changes. If necessary, I would assist with any required interventions while monitoring the patient's condition closely. Keeping the patient comfortable and informed is also essential during this process, as it helps alleviate any anxiety they may experience. 19. How do you handle the emotional aspects of working with ill or terminally ill patients? Working with ill or terminally ill patients requires a strong emotional resilience and empathy. I approach these situations by actively listening to patients and offering support without judgment. Establishing a rapport allows them to express their feelings, fears, and concerns. I also practice self-care to manage my own emotions, ensuring I remain compassionate while maintaining professionalism. When appropriate, I collaborate with other healthcare professionals to provide holistic care, focusing on the patient's comfort and dignity. Being present and providing reassurance is vital in these sensitive circumstances. 20. Can you give an example of how you've worked effectively as part of a team? In my previous role at a care facility, I was part of a multidisciplinary team that focused on improving patient outcomes. We held daily briefings to discuss patient needs and allocate responsibilities. During a particularly busy shift, we faced unexpected patient admissions. I took the initiative to communicate with nurses and support staff, ensuring everyone was aware of their roles. By collaborating and supporting one another, we managed to provide quality care despite the increased workload. This experience taught me the value of teamwork in delivering effective patient care. 21. How do you stay up to date with healthcare practices and procedures? Staying current with healthcare practices and procedures is essential in providing the best care. I regularly read reputable medical journals and follow online platforms that share the latest research and guidelines. Participating in continuing education courses and attending workshops helps deepen my understanding and skills. Networking with healthcare professionals through seminars or conferences also allows me to exchange knowledge and experiences. Additionally, I make use of NHS resources and training modules, ensuring I am informed about any changes in protocols or best practices. 22. What would you do if you made a mistake while caring for a patient? If I made a mistake while caring for a patient, my first action would be to ensure the patient's safety and well-being. I would assess the situation and address any immediate concerns. After that, I would report the mistake to my supervisor or the appropriate medical personnel promptly, ensuring transparency. It's crucial to document the incident accurately for future reference. I would reflect on what went wrong, learn from the experience, and seek guidance on how to prevent similar mistakes in the future to improve my practice. 23. How would you handle a situation where a patient's family member is dissatisfied with the care provided? Listening attentively is key. I would approach the family member with empathy, allowing them to express their concerns fully. Acknowledging their feelings is important, as it demonstrates respect and understanding. After gathering all relevant information, I would reassure them that their concerns will be taken seriously and addressed. If appropriate, I would involve the healthcare team or a supervisor to discuss the issue further. Following up with the family member after the situation has been addressed ensures they feel valued and heard. Maintaining open lines of communication is essential in building trust. 24. Can you describe your experience with basic medical procedures like taking vital signs? In my previous role as a volunteer in a healthcare setting, I gained hands-on experience with basic medical procedures, including taking vital signs. I regularly measured patients' blood pressure, pulse, and temperature, ensuring accuracy and consistency. I learned the importance of using the correct techniques and equipment to obtain reliable readings. Additionally, I understood the significance of recording these vital signs promptly and accurately to aid in patient assessment. This experience not only enhanced my technical skills but also improved my ability to communicate effectively with patients and the healthcare team regarding any changes observed. 25. What do you hope to achieve in your career as a healthcare assistant? As a healthcare assistant, I aspire to make a significant difference in the lives of patients by providing compassionate care and support. My goal is to build strong relationships with patients, helping them feel valued and understood during their healthcare journey. I aim to continuously develop my skills and knowledge to enhance my ability to assist medical staff effectively. Contributing positively to a team environment is essential, as it fosters collaboration and improves patient outcomes. Ultimately, I seek to grow within the NHS, taking on more responsibilities and potentially advancing into specialized roles in the future. In preparing for your NHS Healthcare Assistant interview, understanding the common questions and formulating thoughtful responses is essential. By familiarizing yourself with these 25 key questions and answers, you can boost your confidence and better showcase your skills and dedication to patient care. Practicing your responses will not only help you articulate your experiences but also demonstrate your commitment to the role. If you found this video helpful, please give it a thumbs up and subscribe for more content to support your healthcare career journey.